Thanks for joining us for this session. Our speaker today is Sun Rhyme. Am I saying that correctly?
Yes.
Rhyme, thank you. And he's a clinical pharmacist. Sun consults for CellMed. Our session today is all about immune health alert, clinical enhancement in cellular health activity from a natural anthocyanin-fucoidan. Thank you. Nano complex, AFNC. A little technical there. So with that, I'm actually going to not belabor anything else on the stage here, and I'm going to hand this right over to Sun for his presentation.
Okay,
thank you.
My pleasure. 앉으셔도 돼요. Good afternoon. Hi. Welcome. Thank you. As a pharmacist working over 25 years, I've been talking to a lot of physicians and pharmacists about nutraceutical. And you know what? Majority of physicians, even my fellow pharmacists, they think nutraceuticals are just food. They don't think nutraceuticals has any clinical benefits. Today, I'm going to introduce a very unique, well-studied, designed, researched, and developed by pharmacists, medicinal chemists, toxicologists, and nanoparticle scientists. It's called AFNC. And hi, my name is Sun Rhyme. I'm a clinical pharmacist, and I'm a clinical consultant for CellMed. And also, I'm an inpatient hospital pharmacist. And also, I work for a global pharmaceutical company, Eli Lilly and Company. And today, it's my honor to talk about AFNC. And this great product is from CellMed. And CellMed is a nutraceutical division of JBK Lab in South Korea. And JBK Lab is pharmaceutical company. So we make our product with highest standard and quality. So let's talk about AFNC. So A meaning anthocyanin, F means fucoidan. So we combine anthocyanin, fucoidan as a nano complex for good benefits. Very good benefit, and I'll just discuss shortly. So let's start with the A, anthocyanin. So our anthocyanins from aronia, and as you know, aronia has been known as medicinal plant over 100 years. Especially here in American Indians, they use aronia, which main ingredients is anthocyanin for fighting infection, high blood pressure, blood sugar, cold, arthritis, just you name it. So those are just lists. It's not from me. All the clinical benefits is from global scientists. When you Google anthocyanin, aronia, you'll find that tons of clinical benefits researched by all the scientists all over the world. So some of them, anthocyanin is a powerful antioxidant, and also it is reactive oxygen species scavenger, and also it's beneficial for oxidative stress and CSC, cancer stem cell. This is not from me, this is from all the scientific paper from all over the place. And abnormal cell growth disruption, enhanced immune function, just on and on and on and on, all the benefits of anthocyanin. But there's a limitations. Anthocyanins, once you consume as a food, it just hydrolyzed, oxidated in our system, and it loses efficacy very quick. So it just rapidly clear out of our system. That's the problem with anthocyanin. It's a superfood, super ingredients, but simply we cannot have anthocyanin in our system for better clinical benefits. Plus, its bioavailability is known less than 0.1%. So what's the benefit? To get the anthocyanin benefits, you have to consume tons of anthocyanin. What about fucoidan? The fucoidan was discovered over 100 years ago by Swedish scientists. And fucoidan is simply extracts from brown seaweed, brown algae. So it's known for immune enhancer. In Japan, there are tons of clinical studies using fucoidan for their patients. And there are two greatest benefits of fucoidan is one is NK production, increase the production level of NK cell and also T cells. So what if we combine anthocyanin, fucoidan, combined as nanoparticle for better stability and better bioavailability? As I said, anthocyanin, it has its own restriction, and fucoidan is macromolecule. So to make it better to be in our bloodstream, we have to make as a smaller size as nanocomplex. So give you a little more details. So you see the anthocyanin, which is positively charged molecule, and fucoidan is negatively charged sulfated polysaccharide. So we use ionic bonding and pi-pi covalent bonding reaction. We make and also we make a small as a nanocomplex. So you see the anthocyanin wrapped with fucoidan for better delivery system, better absorption. Very unique. So it was developed by one of the nanoparticle scientists. So let's talk about pharmacokinetics. I know it's a very boring project, the topic, but I have to explain what's the great benefit of making nanocomplex. So I just mentioned that it increased the chemical stability, actually chemical physiostability and bioavailability. So let's talk about one of the pharmacokinetic, which is half-life. As you know, the half-life is when you take medication, it goes your bloodstream. So I would say it's 100%. Then as time goes by, that medication metabolizes and being clear out of your system. So we measured the time between 100% decrease up to 50%, we call as a half-life. So as you can see the graph, just plain anthocyanin compared with AFNC, you'll see the AFNC in rats. So we did preclinical study using animals. So rats, the AFNC actually has longer half-life, meaning it stays in your system longer. That means you'll get more benefits, more clinical efficacy, right? And in a mice study, even is greater. So in mice, there's over 13.38 times longer AFNC stay in the bloodstream. So making nanocomplex, which is our own technology, gives a lot of clinical benefits. One more, the AUC is called area under the curve, simply meaning total drug exposure. So the larger the AUC means you have more drug exposure. So as you can see from graph, just plain anthocyanin compared with AFNC, the area under the curve of AFNC is over 3.24-fold. So AFNC will give you more drug exposure in your system. What about Cmax, which is a peak serum concentration? Of course, is better with AFNC, 4.3 times better. I mean, more peak serum concentration. So now, I'm going to talk about actual in vivo animal study for preventing carcinogen-induced melanoma. Actually, it's not from me. It's from scientific paper. There's two major scientific paper published year 20 and year 21 using AFNC for preventing carcinogen-induced melanoma. The first one is actually from International Journal of Pharmaceutics. This is a top-tier scientific journal. So they used our own AFNC and they did tumorigenesis test. So this is skin of mice, and they induced the skin melanoma using called DMBA, TPA. So those are carcinogen and promoter. And the PBS is simply saline. FU is fucoidan. AN is anthocyanin, and AFNC is our product. So they induced skin melanoma, and you see all the nodules, pellinoma, and they measure in a 9 weeks time mark and 22nd weeks. And as you can see, the PBS, simply the mice was given just saline water. You see the size of nodules and counts of nodules is getting worse. When you compare with fucoidan, anthocyanin, it's a little better, right? But if the mice was given AFNC orally, you'll see the size of nodules and counts is way better. So suggesting AFNC has stable, give you more bioavailability for inhibiting tumor genesis. From the same paper, which is International Journal of Pharmaceutics, they did EMT suppression study. So just simply, EMT suppression study is about inhibition of cancer cell migration. So with the wound healing assay, what it is you look at the picture of human skin cell culture. And in the center part, they scrape up the skin cell, just make it clean. Then, using DMBA and TPA, which is carcinogen, they induced the cancer cell. When you compare just DMBA, nothing was treated, and DMBA and fucoidan, DMBA, anthocyanin, and AFNC, use the migration. So cancer cell has motility, and it has capability of migration. So you'll see the AFNC treated the human skin cell, the migration, EMT was much suppressed. So as a verbatim, I'm just telling you from that investigator saying AFNC effectively suppressed EMT induced by DMBA, which is a carcinogen. The second study, Journal of Food Biochemistry, published year 2021, is all about immune-enhancing efficacy of AFNC. So these scientists, they did two different experiments. One with macrophage, and second is mice. So first experiment, what they did, they pre-treated macrophage with AFNC. Then they noticed AFNC enhanced the production levels of immunostimulatory cytokines and nitrogen oxide in pre-treated macrophage. So nitrogen oxide, you know the immunostimulatory cytokines, but what about nitrogen oxide? Actually, nitrogen oxide is also released from macrophage. It has antibacterial activity. So AFNC enhanced the production level of those when macrophage was treated with AFNC. The second one, So the mice was treated with CP. The CP means cyclophosphamide, is known cancer drug. So it has great benefit as an anti-cancer drug, but unfortunately, it has big side effect. It can cause immunosuppression in cancer patients. So we induced immunosuppression with cyclophosphamide in mice. Then those mice was given orally AFNC, and what they found is AFNC restore the immunostimulatory cytokines, which suggest immune-enhancing effects of AFNC. So this is amazing. I mean, this is just nutraceutical, has a lot of potential and efficacy and science-based. So the picture you're looking at is actually case study journal. So what happened is when we first marketed AFNC, its brand name is Ciaplex F. And you'll find at our booth number 6713. So we marketed this product. Pharmacists getting all the positive feedback, response from their patient. Actually, patient, they bring their picture, their medical report to pharmacists, and look at this. My symptom or my disease got cured, improved. They just keep telling to their pharmacist, and pharmacists voluntarily reported to CellMed. So we collect those case study, and this journal is actually government certified scientific journal. So pharmacists voluntarily report those feedback testimonial from patient, and we end up making monthly clinical case study of AFNC. This is my last presentation. This is actually one of my cancer patients. Since I'm a clinical pharmacist working in a hospital, so this stage 4 skin melanoma cancer patient was treated called imatinib, which is immunotarget therapy. The problem is that patient suffer from so many side effects of imatinib. So unfortunately, she couldn't continue the imatinib. So here's a case. The patient first complaint was severe headaches, 24 hours per 7, all the time. And her liver enzyme and CPK went up. You know that cancer patient, they have to go through every 3 or 4 weeks for blood test before getting their chemotherapy, either immunotarget therapy. So when you look at the graph, when the patient started 400 milligram of imatinib, the CPK start going up to 394 in month 2. Then oncologist was so much concerned, so oncologist put on hold the imatinib. And as you can see, the CPK went down to 165. Then the patient was rechallenged with lower strengths of imatinib, which is 300 milligram. Guess what? The CPK went skyrocketing to 512. That point, patient was given our product AFNC, and guess what? It just went down to 168, almost close to normal range. Great. Same patient. The patient's liver enzyme, which is AST, was skyrocketing. As you can see, well, actually, it's not skyrocketing, but it's out of range. So first month, it started with 69, which is higher than normal, because you know the normal range on the parenthesis 14 to 36. But when the patient was on, it went up to 69. Then second month, 42. Then it was on hold. Then back to 29, which is within normal range. Then patient was rechallenged with 300 milligram of imatinib. Then it went back to 79. That point, our AFNC was given Then AST went down to 42 and 37. So data shows, I don't have to tell you, the data shows the efficacy of AFNC. So, in summary, anthocyanin, powerful antioxidant, fucoidan, immune enhancer, combined together, make as a nano complex for better stability, much better bioavailability with proven data, preclinical study, and one of case study of my oncology patient. So we love to have you all to our booth number 6713, and we can give you more details, more scientific background, and also we have other great product using the same technology. So just stop by 6713, and we love to have you all, and it's been my honor to have you all for my presentation. And also, we have some samples back there on the table, so when you go out, just grab those sample bag for you. And also, our booth 6713, we have great cosmetic samples for you and your wife, your girlfriend, your friends. This is one of the best-selling moisturizer in South Korea. You know, South Korean women, they are pickiest women in the world for picking up cosmetics. That is one of the best-selling moisturizer. My testimonial, my wife, she spent tons of money for cosmetics. Once she started using this, she quit spending that much money. Well, this is my sidetrack, but anyhow. So we have other great product as booth number 6713, and I love to talk about more details, clinical details, scientific data, and introduction of any other great product made by CellMed. Thank you. And we have about 7 minutes left. Any questions, any feedback, any suggestion? Or any great applause? And we have Dr. Zhang. He's a medical, he has a PhD, he's our CEO, and he's the main figure to design this product. He has a PhD in medicinal science. He's a pharmacist, and he's the one started the concept of AFNC. So he's with us today, and also he can answer any questions you have. Thank you. Any questions? Okay then, thank you.